Namaste students. I JV'n Dr. Narendra Singh Shekhawat, Assistant Professor Department of SHALYA from the Faculty of Ayurvedic Science, Jayoti Vidyapeeth Women's University, Jaipur. In previous class, we discussed about definition, etiology, precipitating factors, exacerbating factors, and causes, clinical features, and laboratory findings of ulcerative colitis. Now, in today's class, we will discuss about diagnostic techniques of ulcerative colitis, uh, diagnosis therapies, then management of ulcerative colitis in modern and Ayurvedic also. So, students, let's begin with laboratory. Let's begin with diagnosis. No single test allows the diagnosis of ulcerative colitis with acceptable sensitivity and specificity. The diagnosis relies on a combination of compatible clinical features, endoscopic appearance, histological findings. Stool culture should be obtained to exclude infectious colitis. Colonoscopy should be performed to establish the extent of the disease and to exclude Crohn's disease. Multiple biopsy specimens should be taken from throughout the colon to map the histological extent of disease and to confirm the diagnosis if there is a concern about Crohn's disease. Additional intubation and biopsy of the terminal ileum should be attempted to exclude the presence of Crohn's disease. Common tests to diagnose and maintain ulcerative colitis. Diagnostic testing, fecal sample, blood sample, biopsy, liver and kidney function test. Endoscopic testings. Gold standard for ulcerative colitis, flexible scope inserted into rectum, sigmoidoscopy, colonoscopy also. Visual examination include radiograph, barium enema, and CT scan and X-ray also. Endoscopy findings. The earliest endoscopic sign of ulcerative colitis decreases or loss of the normal vascular pattern with erythema and edema of the mucosa. As the disease progresses, the mucosa becomes granular and febrile. With more severe inflammation, the mucosa may be covered by yellow-brown mucopurulent exudates associated with mucosal ulceration. These are the endoscopic findings. Ulcerative colitis, spectrum disease you can see in this is the normal. First one is normal, right side, right corner of normal, then mild ulcerative colitis, then moderate and severe mild. Ulcerative colitis in Ayurveda we can compare ulcerative colitis with the Raktatisrao. As in Raktatisrao, symptoms are very similar to ulcerative blood mixed with stool, foul smelling, pain in abdomen, burning sensation in the rectum, and excessive thirst. Treatment. These are the treatment in Ayurvedic manuscripts orally and anal route. Orally, we can use churn, basma, various types of churn, ras basma, and quat, asavaris like jirakaris, kurjaris. Anal route, we can prefer picha, sital picha basti and anvasan basti. Pichavasti contains these are the Pichavasti contains Gratam, Grat honey, Quath, Grate, Rasatavre Grate, honey, Quadrave. These are the Quadravs and milk, water, and Kalkadrava. Also, therapy treatment in known treatment in modern science. Medical treatment aminocyclides, glucocorticoids, azathioprine, cyclosporin, infliximab, low phase diet, no milk sometimes. total depression. If mild, if you have mild ulcerative colitis, then we can prefer aminocyclates. If you have moderate symptoms of ulcerative colitis, then we can prefer systemic corticosteroid and oral steroids. If you have severe ulcerative colitis, we can prefer surgery, cyclosporin, and infliximab. Surgery in inflammatory bowel disorders, ulcerative colitis, surgery is colectomy, colectomy and ileostomy, colectomy and ileoanal anastomosis. Surgery, surgery types of operation: total proctocolectomy with end ileostomy, total abdominal colectomy with Hartmann closure or mucus fistula, total prolectomy with ileal pouch anal anastomosis. Types of operation are include colectomy in rectal anastomosis. This is the procedure of types of operation. Second, pancreatectomy, restorative colectomy. Complications of surgery: mortality is high, impotence, pouchalitis, small bowel obstruction, pouch vaginal fistula. Okay, thank you, students. This is this session is powered by Digital Session 2.0 Jyoti Vidyapeeth University, Jaipur. Hope you are satisfied with this digital session. If you have any doubts and queries, please mention in comment box. I will resolve it soon. Thank you, students.